heart attack? Have they had scarlet fever? Do they have any congenital abnormalities in their heart valves? Because those are all important risk factors. Before you do a dental procedure, you might put those patients potentially on antibiotics just to try to make sure that they won't have formation of one of these biofilms on some of those damaged tissues following the dental procedure. So it's really important to know. Okay, so now biofilms are formed in a wide variety of places in nature. Okay, and we can see some biofilms. In fact, we've got some juicy biofilms for you guys to look at. Okay, so in the back here, we've got a biofilm, a few examples of biofilm. Okay, so in this larger dish, this is a combination biofilm. It started out initially as a Kombucha Tea Biofilm, and Kombucha tea, it's fermented tea, and it's a culture of mixed microbes, including bacteria and yeast that carry out fermentation. One of the recipes is you just take regular black tea, add some sugar, and then you add your culture, and these cultures are passed down generation to generation, friends to friends. Now the bacteria and yeast, they start to ferment the sugars, they start secreting that sticky slime layer, and they'll make these incredible biofilms. Now these are classically called kombucha mushrooms, but they aren't. They're biofilms, right? And the reason, to me, this is so cool, you guys, is just imagine that growing on the heart valve of one of your patients. Can you imagine? And just think of the microbes that are deep, deep, deep in these layers. You can see, and if you guys want glove up, I'm being a cowboy here. I should be gloved up. Okay, but glove up and feel how tough that biofilm is, right? And this biofilm, it's actually starting to die. I was a bad biofilm mama. I didn't feed the culture. So it's actually starting to die. It's starting to fall apart. But when it was young, it was so hard. I couldn't press my fingers. I couldn't squeeze it. I couldn't break it down just with the strength of my fingers. So just imagine how hard that would be to treat. If there's bacteria living in there on some surface in your patient's body, how hard that would be, right? Okay, well when I noticed that my Kombucha Tea Biofilm was starting to poop out on me, I was like, oh dear, we need biofilms. So last semester, one of your colleagues brought in a bottle of apple cider vinegar, and she noticed it was getting kind of cloudy, and she's like, what the heck's going on here? Well, and this is great, you guys. It's labeled as organic, raw, unfiltered apple cider vinegar with the mother, quote unquote. And the mother is the culture of vinegar-producing bacteria, acetic acid bacteria. And what are they forming in here, you guys? Why was it getting kind of cloudy? They're starting to form a biofilm, and I was so excited. I go, oh yeah, biofilm. So what we did was we just dumped some of the mother, the vinegar culture, into our kombucha tea, and we can see that those bacteria, those acetic acid bacteria, they started secreting, you know, their sticky slime layer. And here's another biofilm, you guys. And again, just imagine that forming in your patients. Just imagine that forming in your patients. Isn't kind of wicked, huh? So, and then, you know, because we're kind of mad scientists here, you guys remember in our pH lab we gave you apple juice? Okay, so apple cider vinegar, you just start out with apple juice and you add your acetic acid bacteria. So we just dumped a little of the vinegar in here, and look what formed in there, more biofilms, right? So here are some examples of biofilms you can actually touch and get a feel for how strong they are, and just imagine again how hard it would be to treat bacteria forming those biofilms in your patient's body. Okay, just amazing. So again, you guys, I'm being bad. I should have gloved up here. So you guys do glove up if you want to play with the biofilm. If you don't want to play with it, we've got forceps and a probe here. Just so you can, you know, you don't have to touch it, but you can try to tear it apart. Yeah, just go ahead and see how strong it is. Okay, so biofilms will also form out in nature. For example, they're really important for bacteria that live in aquatic environments like streams or lakes. Often the bacteria want to stay in a specific location, maybe that's really rich in nutrients, or maybe the light is just right. So often, these biofilms will be formed, say, on rocks or dead trees, logs, in streams or lakes, and that's one reason why they often feel kind of slimy. That's the biofilm that's formed. Biofilms also form in pipes, in sewer pipes. The bacteria that form the biofilms can often play a really helpful role in helping to digest the poop, you know, the large fecal material in the more soluble waste. Okay, so the biofilm forming bacteria, they aren't always bad guys. That's an important thing for us to remember. Okay, now what we're going to do is have you all sample your own biofilm. Out on the table you might see that we have some white paper. We'll take some sterile toothpicks out there. And what we're going to ask you all to do is to do gram stains of biofilm from your teeth, gums, and your cheek. Okay, so what you want to do before you go out to do the scrape itself, you want to get a clean microscope slide, and you can put two of the smears on one slide. Okay, so you could add 2 separated drops of deionized water, have that ready on your bench, wash your hands, go out into the hall, and with the broad end of the toothpick, gently scrape at the tooth-gum interface. Okay? And you're going to use that tooth scrape. Hopefully you're harvesting some plaque. Plaque is an example of a biofilm. You'll mix that into your drop of water, and then take a second toothpick and gently scrape the inside of your cheek. And be gentle, you guys, because yesterday folks were getting pretty excited, and I was like, oh my God, you're going to be bleeding. They're going like that. So you want to be gentle. You don't have to scrape hard. And the cheek or buccal scrape, then you mix gently in the second drop of water. You're going to dry them on the side warmers, okay? And then you'll heat fix them 3 times. And then you'll take them over to the gram stain stations. And again, you guys, safety, big one, right? Goggles, coats, shoes. You'll take the tooth and cheek scrapes to the gram stain stations, and you're going to gram stain them, bring them back to your bench, and you're going to use your microscope starting with 4x, work your way up to the oil immersion lens, and examine both the tooth and the cheek scrape. So what we're looking for yesterday, oh, it was so wonderful. Some folks had dynamite plaque, you know. This one woman was so worried. She goes, oh my goodness, I brushed my teeth. I go, no, it's normal, it's normal. But look for some nice biofilm plaque. And also we want to see on your epithelial cells, which should stain pink, right? Because human cells don't have cell walls. Don't be surprised if some of your cells do stain a little bit purple blue. You know, unless you add a lot of decolorizer, often your cells, surprisingly, will hold on to some of the crystal violet iodine. We want to see hopefully your big platter epithelial cells with a beautiful oval nucleus. We want to see the little bacteria that are attached to the surface of your cell. Now, many of our oral bacteria are gram positive. So a perfect gram stain of your cells would be appearing pink or red with the central nucleus, and then attached to your cell would be these little tiny purple bacteria. That would be gorgeous. That would be absolutely gorgeous. Okay, so that's really the only kind of activity, hands-on activity we have to do today. And we do have some more things to discuss, though. Be careful, again, you guys, we're all tired, right? Everybody's exhausted. So be careful with your Bunsen burners today. Keep the flames low. Don't leave your Bunsen burners lit. Okay, and